Hey Jan, I've been hearing a lot about the individual mandate. What is it and why does it matter?
Well, Justin, healthcare reform mandates that every person be covered by health insurance.
Oh, like my auto insurance. I need it in order to license my car every year.
Sort of, except car insurance is regulated by each state. The health insurance mandate is a federal government requirement that addresses an economic issue.
Economic issue?
That's right. Everyone faces the same question. Does the cost of health insurance justify the benefit of being covered for injury or illness?
How does the mandated requirement to buy health insurance fit in?
Mandated coverage tries to temper the impacts of something called adverse selection.
Adverse selection? Is that what keeps happening to me on Match.com?
Adverse selection arises when people make choices according to personal needs and desires.
Shouldn't people make purchasing decisions in their own interest?
Of course. However, in the case of health insurance, what's good financially for one person can have consequences for the insurance market as a whole.
How so?
Well, a healthy person may choose not to buy a policy since he doesn't often go to the doctor. He's self-insured. For him, the financial savings outweigh the cost of being insured.
That was me in my 20s. I figured I didn't need health insurance.
In a voluntary system like ours, consumers can opt out of insurance. However, that can raise the cost for everyone who is insured.
Because fewer people share the costs?
Exactly. And those who are insured may be less healthy, and therefore cost more.
So the individual mandate tries to control adverse selection in order to keep the cost of insurance down.
Yes. The idea isn't universally popular, however.
Why not?
Let's say you're shopping for a new car. What if someone forced you to buy a Jaguar?
Hell no, Jaguars are overpriced.
Well, there you go. From your perspective, the benefit isn't worth the cost. In the present system, insurers have many tools for figuring out the right balance between risk and reward when it comes to health insurance.
That seems to be working fine.
But some people weren't able to get insurance because of pre-existing conditions. So insurers will soon be required to take everyone. That takes away their primary means of managing risk and costs.
So that leads to adverse selection.
Right. But supporters of the mandate argue that if everyone is required to purchase insurance, insurers could manage risks and costs differently. And by matching expected costs to expected benefits, they can assure people that the price of insurance is fair and appropriate.
How do we do that?
Most proposals come with both incentives and penalties.
The carrot and stick approach.
That's right. The carrot is usually some financial mechanism to make insurance more affordable. The stick is a financial penalty for people who fail to buy insurance.
So carrots help make insurance more affordable while sticks make opting out more expensive. What about sick people who account for a large part of healthcare costs? Are they left out?
No, starting in 2014 they will be able to buy insurance at the same rates as everyone else. That's why some call for the mandate that healthy people buy insurance, too, so the costs can be spread among more people and hopefully not get too high.
It sounds like the individual mandate is a controversial part of insurance reform.
The challenge is to find the right balance. We need to broaden participation while keeping costs within the reach of most consumers. You can learn more at healthcaretownhall.com.
Healthcaretownhall.com. Thanks.